and also that good health is important for a good life. So I want to help people live their best life possible. That's the bottom line. I started in Chicago as a labor and delivery nurse, and I journeyed out here. And now my specialty is process improvement, which is a methodology to optimize performance and improve quality and patient engagement and patient experience. So I really enjoy working with teams of healthcare providers and healthcare personnel to improve our work and to improve the care of our patients.
Thank you. Okay, Shoshana, you're up next.
Hi, everybody. Great to see everyone. So I'm Shoshana Morel. I'm a nurse practitioner. I'm a pediatric nurse practitioner. I have been for about 10 years. My career began in pediatric primary care, just seeing all the children from birth-ish to 22. And since then, I've narrowed my focus, and I work exclusively now with adolescents for the last little over 6 years. And my current role is in a school-based health center, which is like a little clinic that is embedded in one of the public schools in Seattle. So you can imagine things have been a little bit different this year. So my entire population are middle schoolers. Oh, and inspiration for becoming a nurse. Sorry. My inspiration for becoming a nurse actually goes back to, unlike Debbie, my family is not in the nursing business. None of them are. They're all in another business. And so it was not even a thought in my mind that was one of the possible roads for me. But when I was in high school, there was a school-based health center at the school that I went to. And I found it to be a very welcoming and comforting place. And I spent quite a bit of time with the nurse practitioner there. Of course, I didn't know what a nurse practitioner was then. So I just thought, I don't know who that lady is, but I like her. Anyhow, I went on to find out what that was and pursue that specifically because I wanted to work in school-based health.
Thank you. Up next, Deb Kadish. Deb, oh, there we go.
Yeah, got it. So I also, my mom also was a nurse. And so I grew up kind of hearing her stories of, she would come home and tell me about the interesting people she met and kind of funny things. And I actually went to school. I went to school, I was doing pre-nursing, but then I decided that I wanted to be a theater major because I had always been involved in theater, and my parents told me that that was fine. But as soon as I had that piece of paper, I was on my own. And then I decided that maybe nursing was a little more stable of a career, and that theater could always be a hobby. So in the end, I'm a nurse who enjoys going to the theater. But yeah, so I don't really know. I didn't have like a specific tie. There wasn't, luckily I didn't have someone who was sick or anything like that, but went into nursing, enjoy the caregiving aspect of it. I ended up straight out of nursing school, I ended up working inpatient bone marrow transplant through Fred Hutch when the program used to be up at Swedish Hospital. When I graduated in 91, I grew up and went to nursing school in Oregon, but came up here because I was lucky enough to get into the Hutch, which is kind of the that's where really bone marrow transplant started. And I did that inpatient for 9 years. And the Cancer Care Alliance kind of happened on paper in 1998 and about 1998. And 99 and 2000, we were in transition. And then when the alliance happened and I had come back from maternity leave, I ended up going to the outpatient department and subsequently to the Seattle Cancer Care Alliance. So now I work 50% still on the outpatient infusion floor at SCCA. And so we do not only the transplant population, but all of University of Washington's outpatient oncology program. So all solid tumor, general oncology. And then since December, I've been doing 2 days a week at our COVID vaccine clinic, which has been super fun because we got to vaccinate our staff first, and slowly but surely things have expanded and we've gotten to see new populations, including older people and our patients. And then over the last month, teachers, childcare workers, and today was a big day because we saw lots of people in transportation and food service, not restaurants, but like grocery stores and things like that. So that's been a really neat, it's been nice to feel like we're moving forward.
Thanks, Deb. Okay, Cheryl, you're up.
The dog is out of the house. Along with the husband, who actually is a bone marrow transplanter. So you probably met my husband. He developed stem cell transplant while he was at the Hutch. So that's why we're in Seattle. So I've been a nurse since 1977. So a long time, and I've done a lot of different things. My mother taught biology. My dad was a scientist, but they wanted me to be a graphic designer. And somehow, I don't know how it happened, but somehow I ended up transferring to the University of Washington and getting into the School of Nursing. And I just like people a lot. So it was a good fit. I've done pretty much a little bit of everything. I started out in crisis mental health at Yale University. Then I trained at University of Utah to be a nurse practitioner. So I became a nurse practitioner, an FNP, family nurse practitioner in 1982. So I guess I was a pioneer. They wanted us to go to Tickaboo, Utah, and paid for my education. The US government did. But I ended up going out to the West Coast to Stanford with my husband and worked at a free clinic in Palo Alto. And that sort of led me into the path away from hospital nursing and into working with a lot of at-risk populations. And I've done that ever since. I took a long break when I had my 3 children to raise them, and started working in advocacy, which is a very important piece of nursing, and still do that. And then went back when they went to college and got my master's in public health and health disparities in primary health care. So that really changed my focus. So I practice now using my RN and work mostly with the Public Health Reserve Corps here in Seattle, the King County Public Health Reserve Corps. As a volunteer, I started a program to care for homeless people experiencing homelessness in Seattle. And Janice Kaplan knows, she works with me doing foot care at one of our sites. We're on hold right now because of COVID. So I've been helping with all kinds of other stuff until I hurt my knees a couple weeks ago. So I'm hoping to get back on my feet as soon as I get my steroid injection next week. But thanks for inviting me.
Okay, thanks so much. Our next question, I'm going to ask Debbie and then Shoshana to answer, and that is, or to tell us. Debbie, what was the most memorable experience as a nurse?
So I have been a nurse a long time, and I've lost most of my memories, but I'm kidding. I think be the most memorable, there's not one thing, but just being a labor and delivery nurse, the intensity and the responsibility of the start of life was really exciting and fun a lot of times. And I love that job. That was just the greatest job I had. But then I started thinking, this is just a finite time in people's lives. And I wanted to make more of an impact on people's lives. And so I also went into public health. And I went to community health nursing and worked at Seattle King County for 15 years, public health. So yeah, it's the intensity of the one-on-one interaction and just helping people through a super intense time in their lives.
Thank you. Shoshana.
Well, I first just have to say that hearing from all of you other nurses is so inspirational. I love each of you because you each are doing such important work, and my work is also public health because I'm working in a community. And I think that the most memorable experience that I've had as a nurse was not when I was working. It was when my son, who was born with a genetic disorder linked to Ashkenazi Jews, was transplanted, stem cell transplant, at Duke University as a newborn.
Wow.
And my understanding of what nursing is and what it means to be a part of people's health crisis journey, whatever that may be, grew exponentially during that time. We had to go to, unfortunately, SCCA does not transplant pediatrics for metabolic disorders. So we went to Duke University in North Carolina. I was there for 5 months. And there's a lot more to this story, and I'm not going to tell it all tonight. But when I hear that folks are involved in transplant, when I hear that folks are involved in working with people who don't have homes, when I hear that labor and delivery, I look into my own experience on the other side of the coin, not so much homelessness, but certainly working with a lot of high-risk populations as well. And I feel so much gratitude for each of you. So it really changed my approach to nursing when I was in the position, and as a pediatric nurse, you're always working with families, you know, when I was in the position of being the recipient, or my son was the recipient as a family of that care.
Thank you. Okay, my next question is going to be for Cheryl. What was your most challenging experience as a nurse?
Challenging. I mean, I feel challenged every day because, especially these days, the people I've always worked with were either very, very sick. When I first started out in crisis mental health, we had like 2 drugs for someone who had a schizophrenic break. I was at the place where they developed antidepressants, and everyone tells me it was the golden age of medicine, of psychiatric medicine. But every time I go out, it's a challenge. Every time I, put someone's foot in my lap to see, what they need. And by the way, it's the best way to get a history. But it's a challenge to develop a relationship with that person in a short period of time, to evaluate what their most critical need is, and then to help them through making a decision about what they want to do about it and whatnot. So every time is a challenge.
Thank you. Deb.
I just want to say one thing, and I think that being that we do have people who are care for our high-risk populations, is I find the biggest challenge is the bureaucracy of healthcare. I think it's not built to really take care of the most needy. There's so much inequity, the cost, who we're reaching. We're seeing a lot of that now with the COVID vaccine and populations who are not trusting healthcare as much because of our history. So I find the bureaucracy and the way we need to really rebuild the healthcare industry to a better way.
You're right. I think though, when I noticed a big difference in our care program, when the state of Washington agreed to expand Medicaid, it was like a lifesaver. I couldn't get people to go to the hospital, even if I called an ambulance, until they literally fell over and were passed out and didn't know what was happening to them, because they were so concerned about owing money or having a warrant. Or you're right. And accessibility is a really big thing. It's a big problem. Yeah. And bigger now.
Deb, your most challenging experience?
I think for me, so when I graduated from nursing school and started my job on the inpatient bone marrow transplant unit, I was 22 years old, and straight out of nursing school was working on this unit that was really intense. At the time it was bone marrow transplant. Now we really don't do bone marrow. It's all stem cells. It's the same basic thing, but we've come a long way but they only started doing transplants on people in the 1970s, and I graduated from nursing school in 1991. So when I think back on it now, I realize how young of a science it was. So it was really intense, and it was tough. And these are people who had no other medical option. And the floor I worked on, we did kids and adults. And so shortly after I finished my orientation, my very first primary patient I was assigned to was a 7-year-old girl who was having her second transplant. And not surprisingly, she died. And I thought, what have I gotten myself into? I don't know if I can do this. And so I would say my most challenging and my most memorable moments are really one and the same. I know you didn't ask me that question, but to me, it's the same. There was another nurse who kind of pulled me aside, and I have repeated this advice countless times over the years. And she pointed out that if this wasn't the right place for me, I needed to go somewhere else, because it's way too tough emotionally to do something like that if you don't feel like it's the right place for you. But if I left and went and did something else, it wasn't going to make those patients go away. It didn't mean that those patients were magically going to all be better. And so that maybe there was something to learn about the fact that if I stayed, even if the outcome wasn't what we wanted, it didn't mean that I didn't make a difference in someone's life. And like Shoshana was mentioning too, right? When you're dealing with kids. And at the time, people stayed, we have much, much shorter hospital stays for stem cell transplant patients now. At the time, if you did well, you were in the hospital 6 to 8 weeks. And if you didn't do well, you were there longer. So we knew the parents and the siblings and the aunts and the uncles and the family friends, they were there for so long. So it was really hard. But you did learn that even if the outcome wasn't what you wanted, it didn't mean that I hadn't made a difference in someone's life. And lastly, in that type of situation, you can look at your glass as half empty, because overall long-term survival rate at the Hutch at the time was about 50%. So literally half empty. Or you can look at the fact that without transplant, not a single one of those people would survive, because you only move to stem cell transplant when conventional chemo hasn't solved your problem. So that's, and I've carried that with me and passed that information on. I feel like that's something that's stayed with me.
Thank you. Debbie, how do you feel that the nurses' education has changed over the years?
So I think it's gotten better, because my nursing instructors were not very nice. And I think they're a lot nicer now. But besides that, like, I was looking at the UW statistics. I'm a alumni from my master's degree, and they only accepted 1 in 10 nursing students this year. And I think that's horrible. I think that there's so many people who want to be nurses that we should not be stopping them. Nursing, as we've become more professional, a lot of the bachelor's degree programs insist on having doctorate degree instructors. And I really don't think that's necessary. And I think it's really limiting how many people can go into nursing. I think we've gotten a little bit more diverse. We have more men, we have more people of color, but I think, I really think that we need to get out of our ivory tower a little bit and really open it up to a lot more people, because we need the nurses. We have a nursing shortage and we need the nurses.
Thank you.
I'll try not to make all my answers political, but some of them are.
They all have to be.
Okay. Actually, next question is going to be for Cheryl, so you will have a chance to talk. I know you want to say something, and when my question to you is actually from when you started as a nurse, how have things changed?
Okay. Well, and just in response to what Debbie was saying, I was a member for 8 years, I think, of the Dean's Advisory Board at the University of Washington School of Nursing, and just really advocated for educating more nurses, for having all nurses get a BS if they want to have an RN, but also faculty. Recruiting faculty is a really tough, sticky wicket, and a lot of faculty are retiring, and we're not replacing them. So what was my question?
Your question was, how have you felt that nursing has changed from you started?
Well, as Debbie said, it is a lot more diverse. We have students that come through our care program, and I'm actually was asked to come and help some of the students at UW. I've been going for the last few weeks at Tent City 3. They started a foot care project there, and they're all students that have a degree in another discipline. Several of them public health as an undergrad, some science degrees, some philosophy, but they decided they wanted to go back and make an impact and be a nurse. So it's really fun working with them. So I think so much more opportunity. I mean, when I got into the UW, I was just lucky. I was in a lottery. That's how they picked people. If you had a certain GPA, and my dad, being my dad, called the dean and said, I missed the first one, in the next round, he said, you need to pick a few students just for their GPA. And so thanks, Dad, I got in, but it's always been tough. And I call nurses the workforce for the world. We are. And we need many, many more nurses. We need nurses, though, also out there on boards. We need nurses in the law. We need nurses in politics. We need to be everywhere, because we do really make a difference. And like we were talking about before everything started, we're the #1 trusted profession. Yeah, things have changed, but things need to continue changing. Online schools, there are lots of things, but I think, like Debbie said, we need more numbers.
Thank you. Okay, so the final question, just give us one line. in the interest of time, I'm going to, so the question is, how has COVID impacted your work as a nurse? I'm going to start with Shoshana.
One line. Okay. Well, you know, a year ago, the students were sent home from school, so I didn't have patients. And I immediately switched to providing virtual care. And I was ordering COVID tests left and right and sitting in front of a computer, just chatting, not even nothing, just text, chat. You have these symptoms, you get the test, you don't. And I learned a new skill that I didn't particularly enjoy. And now I'm back working with the kids, but it's very difficult to access them.
Thank you. Deb, Kadish.
So my job actually hasn't changed all that much. We continue to see patients. Our census dropped quite a bit late spring, early summer of last year. SCCA and UW, I think, stopped taking for a short period of time, stopped starting treatment for patients. Anybody that could wait needed to. So our census dropped quite a bit, but we are currently busier than ever. So other than, PPE, we wear masks all the time now, and eye protection, that and only one caregiver. But I think for me, things have changed probably less than for many. I still go to work. I go to work, which I've done the whole time. We were lucky enough to be vaccinated we started our vaccinations for staff like the end of December. But yeah, for the first 9 months, we all went to work every day and worked with our patients, and there's no social distancing when you're providing direct patient care. So for me, things, as much as they've changed, they've not changed.
Okay.
If that makes sense.
Yeah. Debbie.
So I've always been proud to be a nurse, but through COVID this past year plus, I have been even more proud of what nursing has brought to the table and how we have been invaluable on so many levels, in so many ways, of helping our country get through this. And I think we're all exhausted. As much as lay people, not healthcare people, are exhausted, we're 100 times more because of the stress of the illness, the death, and now the stress of health. A lot of healthcare facilities are broke or have a lot of financial problems because of it. So that's stressful. So it's pride and it's exhaustion.
Thank you. Cheryl. Unmute.
Yeah, for me, I remember it was the last time I was helping in our care program. I was at St. Vincent de Paul Food Bank down in Georgetown. And I saw a gentleman who had the worst, most awful cough, and he was really in bad shape. And I sent him down to CMAR, and I keep thinking, wow, I wonder how he is, because I got a hold of everybody at Seattle King County and said, we can't keep doing this. Our volunteers are mostly retired nurses, and we don't have the right PPE. And then our sites where we went, the food banks, the shelters, Real Change, Recovery Cafe started closing, and we didn't feel it was safe to do foot care or any of those sorts of things. So the hardest thing for me is I can't hug anybody anymore, because I'm always ready to hug somebody no matter what. But also I see some of my peeps out there sometimes, and we can say hi and whatever, but I just wonder how they're doing and how much they're struggling. I've been at a few venues like the smoke shelter this summer and things where I've seen people, but I think that's the hardest part for me.
Thank you. Beryl, any questions from the audience?
Not so much questions, but I'm just going to read out what people wrote. Laurie Brown said, keeping faculty is also very difficult as it's one of the lowest paid areas of nursing, which I had no idea. And then Susan Adler said, the examples each of you have given about your relationships with your patients are striking. At the end of each day, when you return home to your families, how do you balance the challenges you face at work with the rest of your life responsibilities? So I guess that is a question. Does somebody want to answer that?
Yeah, who'd like to take it?
Well, I can just
Balance,
tell an
balance.
I can tell an anecdote. It's Cheryl. Students come and work with us, and one of them said to me once, they said, "How do you do this? I cried all the way home in my car." And I said, "We do that too."
It's a calling. It really is a calling. And it's so rewarding. It's so rewarding. And that's how we keep doing it.
Thank you.
And there are times when it really stinks. And I wonder
yeah.
why I didn't become a barista or something. But then you go back the next day and
We don't leave our, I mean, I can only speak for myself, but I can't leave my work at work. I'm always, if there's a young person who's at great risk or who I feel like might be in an unsafe situation, that is something that I take with me. You know, I know that I'm not in any way going to be someone's savior. I cannot change the conditions that this person is living in, but I do believe that caring and holding that person in your heart does have an impact on their experience, however small. So in a way, it's the fact that we do hold them that, you know, is part of what we're doing to help them.
Well put. Nicely said.
Thank you. And then Bonnie said, Bonnie Astor is also a nurse. She said, I was a nursing clinical instructor at a small university for 13 years. I was 24 years old, had 10 students who each had 2 hospitalized patients for 8 hours, a tremendous amount of responsibility, not highly paid. The pipeline is clogged as to educating everyone who wants to go into nursing. Thanks for that, Bonnie. Jackie Bailey said, thank you for keeping with bone marrow transplant work, as by the time my son needed one, the science was so far advanced, and 10 years later, I can hug him. Thanks, Jackie. And then Natalie Connor, who's also a nurse, she said, I love my colleagues, and even when I have a rough day, I want to continue to support them. Also, the high of providing good patient care keeps me going. So thank you for all those beautiful comments. Do any of the nurses have anything else they want to say before we end off? Yes, Cheryl?
I just wanted to say to Bonnie, I understand that there's also a problem with nursing students that we don't have enough clinical site placements any longer. Our hospitals have been consolidated, and people don't go to the hospital any longer unless they're really sick. So we've been doing sim learning, which is a whole new thing that I didn't mention. Seattle U has an awesome sim center. UW has one. We're trying to make it better all the time. But that kind of training that we got really the interaction with the patients isn't there to the degree that it used to be. And I think that does impact the kind of training that people are getting.
Yeah, thank you.
I have one last comment for me.
Yes, Debbie.
Is I wanted to thank you and thank Seattle Hadassah for honoring us and letting us share our love for nursing, because I think that came through pretty clearly. And to thank you for honoring us and letting us come and share ourselves. Thank you.
It's a pleasure. You all deserve it. And, you know, we couldn't do without nurses. So thank you to our wonderful panel. Thank you for sharing your stories and for highlighting the wonderful, caring world of nursing. And thank you to Lauren for moderating. Please remember to sign up for the Seattle Hadassah Virtual Gala, where we're going to be honoring these 4 women and 30, right now 36 other nurses in Seattle. So please join us on Sunday, April the 18th at 7 p.m. It's going to be a wonderful event and very exciting to support Hadassah. So thank you all for joining us this evening, and we'll see you on the 18th. Take care. Bye. Thanks, Lauren.
Welcome.
Thanks, everybody. Bye.
Thank you.
Thank you very much.